So we just got out of the annual enrollment period for Medicare, but there's actually another one that's coming up that a lot of people really don't know about.
Yeah, it's rather confusing because it's called open enrollment, where most people think, well, we just had open enrollment, but that was annual enrollment. And it is a little different, okay? So basically, it's an opportunity that runs from January 1st till March 31st for individuals who have Part C Medicare Advantage plans to swap to another plan for whatever reason, or to go back to original Medicare by putting in a Medicare Part D application request. Now that puts them back to original Medicare, but then original Medicare has all those out-of-pocket expenses, no max out-of-pocket. It does not necessarily offer you the guaranteed supplement rights to purchase, depending on the situation. And if you put an application in January, your effective date would start February, in February for March, and March for April.
Okay. Why do Advantage plans get, this extra time to shop?
Good question. Yeah. So a few different reasons. Maybe they thought they had some prescription drug coverage. Maybe they're finding out in January at the pharmacy that it's no longer covered. Well, what do I do? Now you still have that chance to change. And local residents, there's a big issue going on. Lehigh Valley Health Network and United Healthcare, they're breaking up. Simplest terms, if you have United Healthcare Medicare Advantage plan, not the supplement, but if you have the Medicare Advantage plan, you can't go in network to Lehigh Valley Health Network, and that's supposed to end on January 26th. So if it does, it gives somebody who has that Medicare Advantage plan from United Healthcare the opportunity to shop, move to a plan that has them in network, and that's a great opportunity for individuals. So I'm glad this period exists.
So if someone has the Advantage plan and missed the last enrollment window, or they just want to look at different coverage, what can they do?
Yeah, shop coverage. Yeah, that's something that we're able to do. We're licensed with all the companies, okay? We're going to make sure that their doctors are in network, okay? We're going to see that their prescription drugs are covered. We're going to show them the options. If they're in the best plan, we'll let them know that. There's no need to change if that's the case. But if it's really not the case, now's your chance to do something about it.
It sounds very complicated, but the nice thing is you know what's happening. You can talk someone through and just advise them on, here's some options, or do nothing.
Yeah, we want to make it easy for them and have the understanding of just taking the time to look at their situation. Each situation's unique.
Right.
We've seen all the cases, so yeah.
Well, Mike, thank you so much for joining us on Community Connection.
Thanks, Liz.